Welcome to a new video at Nuarch by Dr. Sal. So in this video, we want to answer some questions about periodontal disease. The first question is, what is periodontal disease? Well, people who go to their dentists and see their hygienist regularly must have heard of this word. Periodontal disease is a disease of the bone around teeth, and it's a very slowly progressing disease, but it causes real damage to the bone surrounding the teeth, leading to big problems. Second question, how do you know you have periodontal disease? Well, there's the early signs, there's the later signs. When periodontal disease starts, it usually starts very mild, and you might see some blood around when you floss your teeth, if you do, or when you brush your teeth. Your gum just doesn't look that healthy. You could tell. And as it progresses later, you may start to see your teeth become longer. And when you chew, you don't feel them as strong in your jaw bones anymore. So that's a point where some bone has been already lost. And people might complain about your breath because the presence of bacteria associated with this problem will cause bad breath. That's probably one of the biggest causes of bad breath. And so these are the basic signs of periodontal disease. So here's another question. Can this disease, periodontal disease, be reversed? Well, the answer is yes, but it does depend on the severity of the disease. If it's early on and you have a good relationship with a dental professional like a hygienist, a dentist, they'd be able to diagnose and lay out a plan for you how to deal with this problem. And yes, if it's caught early on and if the main causes of the disease is addressed, the tooth can become healthy again. So another question is periodontal disease more common in certain age groups? And the answer is yes. There is actually a type of periodontal disease called adult onset periodontal disease, and this is very, very common in adults. People who hit their 30s, they should be looking out for that. They usually start in certain areas around the upper molars, between the back molars is where they start, or the front teeth, and then they show a typical pattern of destruction of the tissues if they're not cared for. There's also other factors, but the answer is yes, it is more common in adults. So question number 5, can periodontal disease lead to tooth loss? Every day of the week. That's actually the most common reason, probably after tooth decay, the reason for loss of teeth. It's actually probably the number one reason for tooth loss among adults, maybe as much as tooth decay. And the reason is this is a silent disease. So until it's progressed and teeth are rocking and rolling, you really don't know that you have this problem. And oftentimes people come to us and they have no hope for the teeth. It just cannot be, it's not something that can be helped with. Teeth have to go. So we encounter this pretty often in our practice. Here's another question, and this is a real important topic. What's the relationship between periodontal disease and overall health? And the answer is a lot. There's all sorts of studies describing problems with pregnancies, childbirth, linking to periodontal disease. Periodontal disease is linked to heart disease, diabetes, you name it, any sort of disease, it's linked to periodontal disease. There's great evidence right now. And the reason is obvious. When you have so many bacteria, so much bad bacteria in your mouth, and you're harboring these and swallowing these every moment, you can't expect a healthy body. It just doesn't, it doesn't work like that. Periodontal disease can also cause inflammation in other parts of the body. As a matter of fact, when we very frequently get letters from MDs, our medical colleagues, requesting a clearance for their patients who are going to go under involved surgeries, because they want to make sure their oral bacteria is in good condition. They don't have infections and periodontal disease, which is an infection, so that they can safely do surgery on their patients, and the outcome of that surgery is going to be good. So it's amazing how related everything is. So here's the last question: is a patient with periodontal disease, perhaps a severe periodontal condition, can he or she be a candidate for dental implants? And the answer is yes, most of the time they can be. One must understand the periodontal disease is a disease that has to do with the teeth. So if the teeth, if the teeth are in bad condition and they're removed and the bone cleaned, the periodontal disease no longer exists. So during these procedures, we make certain that the teeth are removed and the bone is cleaned, and then we utilize the good bone that's under the level of the teeth most of the time. So we have treated many patients with severe periodontal disease successfully. And thank you for watching. I hope this has been helpful. If you have any questions, feel free to send it our way. We'll be happy to answer them. Nuarch by Dr. Sal.